Good Friday, everyone. Nice for you to be here again today with us. A little bit of sunshine out there, huh?
Yep.
What's going on? And we got Chrissy.
I'm back.
She's not camping this weekend. I hope I'm not camping at the Elliott with Sherry.
Nope.
But it's really looking like
so.
it. I know.
Day 4 of past due date.
Oh,
Right?
man, I'm telling you, and every day's been another set of events.
Yep. Seriously.
Anyway, today we're going to talk a little bit about sinuses. And before we get into that, I actually had an epiphany through the nighttime last night. And I think what I'm going to do, since we've been on this trajectory of allergies, cold symptoms, I think I'm going to start doing things in a cephalocaudal manner, which means head
Head to toe.
Oh.
head to toe. So I think we're going to be concentrating on the head things first.
What is it?
Cephalocaudal.
Oh,
Look it up.
okay.
Okay.
That's the reason why I just answered the phone up front.
All right. So anyway, a lot of people come in. We have lots of people who make appointments for a sinus attack or a sinus infection, and this can be pain in the forehead or between the eyes. Upper teeth ache. A lot of people complain of that. Their face feeling full, stuffy nose and congested. Those are common complaints of a sinusitis or a sinus infection. What are the sinuses? We actually have 4 sets of sinuses, and these are just air-filled cavities that are lined with mucus. And when those get inflamed and aggravated, a lot of people think that they have an actual sinus infection, which it may be a sinusitis, but not a bacterial infection. All of these sinuses are lined with little hairs, like the little hairs in the nose. And what those hairs are supposed to do is propel the mucus and not propel the mucus so much, but propel the bacteria, the viruses, the allergens out of your nose or out of these sinus cavities. And then they don't get infected. They don't stick around for a long enough period of time. So that inflammation is what actually causes all of the issues. It typically starts with a cold or starts with allergens. And that's why we say, really, we don't even like to see you for 10 to 14 days of those symptoms, because your body will probably clear it on its own. It's probably an allergy attack. If you take care of the allergens, it won't develop into anything. Or if it's a cold, that's self-limiting like we talked about the other day, and that's gone by 14 days. So again, it's a cold at first, and how does it feel? Can you guys, have you ever,
Like
either way, you ever
stuffy
had this?
nose, lots and lots. I usually get like lots of face pain, headache.
Where is your
The face pain.
face pain?
It's all right here.
Okay.
And one time I had one for a long time, and I tried to treat it myself. And my teeth actually, I started to feel like I had an infected tooth.
Okay.
Yeah.
All right. So, yeah, that's typically what
Yeah.
people complain of. The sinuses are here. These are the ethmoid sinuses, the maxillary sinuses, and then you have sinuses behind the nose and underneath the brain, okay? Those are your main sinuses, and when those get inflamed, because that's what itis means, okay? Itis of anything just means inflammation of, so sinuses, sinusitis, inflammation of the sinuses. So, next. We'll do the next one. What happens when it doesn't go away? Then that's when we want to see you, okay? We'll see you at any point in time, but we just don't want you to come rushing in, because let me tell you, as a clinician, I'm not going to see a sinusitis. There is no magic to that. My diagnosis really comes from your history and what you're telling me your complaints are. So, you know, there's not a whole heck of a lot I'm going to see. The nose might be red and swollen. I might see some purulent, which means colored drainage. And by the way, a lot of people do say that. I have green drainage or I have yellow drainage.
Yeah.
My first question back to them always is the same thing. Is it just in the morning or is it at nighttime? Because those times of days, that's just your body. First of all, the morning time, it's the secretions have been sitting there all overnight. You get up, you take your shower, everything kind of opens up in your drain. It's better through the daytime, and then at nighttime, just because we're tired and everything isn't working appropriately, you may have yellow or green drainage again. But that does not mean a bacterial infection per se, right?
Right.
All right, You know this one because this is your
Love
favorite.
it. Love it.
So what do we do for it? What are some natural things that we can do for sinusitis?
Yeah, so the sinus rinses.
So are you talking like neti pot, right? Or the saline washes?
Yep.
You know, it's funny, in these rooms, day after day, year after year, I would tell people, if you just use a neti pot, you won't believe how much that will clean out all of these passageways. And nobody would do it. Everybody thought that was the grossest thing they ever heard. And then all of a sudden, I ran into this span of time where people were telling me, oh, I'm using a neti pot. Like we had never talked about it, right? And I'm like, you are. That's wonderful. What made you start doing that? Well, Oprah had a show on it.
Yeah, of course.
Okay, so thank you,
Gotta be
Oprah.
somebody.
But it does work. You just have to be careful about the solutions that you use in that.
And the water.
No tap
right?
water.
Exactly.
Yeah.
Exactly.
Water.
Yep, should be distilled water.
Yep.
Okay, that's exactly right. And you have to make sure whatever contraption you're using, whether it's a squirt bottle or like
Sterilize.
yeah, you need to have that
Yeah.
nice and clean.
Yeah.
Okay, that's real important. So, how do we know if they need to have an antibiotic? Again, it's really what I said before. If this lasts for a long period of time, some people will say to me, listen, I got a sinus infection.
Susie, leave Oprah alone.
I know, Susie. I wasn't dissing on her for you. Anyway, the antibiotics, this major study just actually came out not that long ago. There's been quite a few studies over the past several years, but a big one in JAMA, which is a pretty highly respected journal. And that one was, we had a phone call here in between. Elise, she'll get back to you. So this study looked at 250 some odd patients who complained of having a sinus infection. They divided them up into 4 groups, okay? And in that 4 groups, one group was given antibiotics, one was given a nasal decongestant, one was given an antibiotic and a nasal decongestant, and the other group was given nothing. It was just nothing at all. They weren't given any treatment. And guess who did better, guys?
No treatment.
The last no treatment. It's self-limiting, and that's how we came to know that probably not everybody needs to be on an antibiotic. 90% of people who go to a healthcare office for a sinusitis get an antibiotic, all right? And less than 70%, more than 70% didn't need it. So that lends us to this whole thing about antibiotic resistance, and now we need to choose an antibiotic, and we can't because people aren't responding the same way, okay? And antibiotics, there hasn't been a new group of antibiotics out since the 80s. There's one right now coming out that looks very promising, especially for resistance. But guys, we gotta ease up on this. And really and truly, I got to leave it there because we're running too long, but I just want everybody to know children don't get sinus infections, all right? Oh, actually, let me back up before the children. Is all of us have our own fingerprint of sinuses. I told you where they're located. However, I may only have one sinus here, one here. Everybody has something different. It's not like we were all built the same way with our sinuses. Kids do not have sinuses. They don't develop until they're 6 to 7 years old, and they can't get infected until they're a teenager. So it's probably a cold. So, you know, when you go to your healthcare office, you probably don't want to start with, I know they have a sinus infection, because that's just not even a possibility. All right? Send in your questions, concerns, try to avoid allergens, try to avoid colds, wash your hands. If you were Susie, you'd be bleaching your hands. But yeah, just try to prevent all of those regular things that hopefully that will prevent a sinus infection. Okay, or sinusitis.
We had somebody had submitted a question about treatment for Lyme disease, oxygen therapy.
So I don't know anything about oxygen therapy. The most I can tell you about anything like that, there is a laser center, a laser Lyme center. I think it's New England Laser Lyme. It was in Exeter, and now it's in North Andover.
Okay.
So they may have more information on that. I'm not sure. That might be something that a chiropractor around here is doing something about a cold therapy or
Oh, I've seen that cryo.
and unfortunately I just don't know about it, so I'm sorry I can't help you with that.
Next week we'll announce our new contest. That we'll have a lot of people. We'll have a few more than one winner. We'll announce that next Friday.
Like 170, right?
178 winners, maybe, give or take. This is just another Joan project.
Oh boy. Right.
So stay tuned. And next Friday or maybe even Tuesday, we'll be able to announce a new baby.
We
to
hope so.
Landmark.
We hope so. This has just been crazy. She's in my office laying on the floor as we speak.
Another Friday.
Yeah, exactly.
Seriously.
All right, everyone. Have a great weekend.
Bye.
Have a good
Bye-bye.
weekend.